Experts and campaigners are warning that services for people with ME in Scotland are at rock bottom after the death of Scotland's only specialist nurse on the condition. It leaves Scotland without any service of this kind on the NHS, despite evidence of rising demand. ME, or chronic fatigue syndrome, causes extreme tiredness and is thought could impact as many as 50,000 people. Here's our political correspondent, Georgia Roberts.
For those severely impacted by ME, the concept of lockdown isn't new. The extreme fatigue it causes can leave people housebound for months and can make even the simplest tasks a challenge. The COVID pandemic has seen a spike in post-viral illnesses like this. Now there are fears that the death of Keith Anderson, Scotland's only specialist nurse on ME, has left just pockets of provision based on outdated models of care, despite rising demand for services in recent years. Whilst there's a UK-wide shortage of support in this area, England has several more clinics and medics offering diagnosis and care. Experts have accused NHS Scotland of a serious failure of duty. The Scottish Government says it's committed to creating more equality on ME services across the country.
Campaigners are warning that services for people with ME are at rock bottom after the death of Scotland's only nurse who specialised in the condition. Keith Anderson was based in Fife, but the service has now been paused since he passed away last year. The Scottish Government says it's considering a recent analysis of provision and is committed to creating a more equitable service. Well, let's discuss this more now with Karina Raman, who volunteers at the charity ME Action Scotland, and Paula Notman in Dunfermline, who has the condition and was supported by Keith Anderson. Good morning to both of you. Thank you for joining us. Paula, you benefited from Keith Anderson's support. What difference did having this dedicated nurse make?
Good morning, Laura. Yes, I benefited. I was lucky to speak to Keith quite a few times and have his support during some really dark times, having ME myself. So to me, it was very important. And he helped me a lot, not only sort of with my mental health, not mental health that was wrong with me, but mental health because of having ME and not having the support that people just don't get in Scotland. So yes, I was very sad to hear that Keith had passed away, because I didn't realise until I actually read it on the ME Association website on Facebook.
And could anybody else have offered you that service, or was having the specialised nurse the main aid?
I think, to be honest, it was the main aid because there's no other help out there. I mean, I personally was back and forwards to the GP. You know, my experience, being diagnosed probably 7 or 8 years ago, and I probably had it 10 years plus, after having a bad flu. And you just don't get any help. You just get sent home, you get offered antidepressants, they do all blood tests and say everything's fine. And speaking to Keith, it just validates, how you feel, and you do have an actual disease. That there is something wrong with you, and it's not all in your mind. Which can be very depressing, when people keep telling you that.
Paula, there's a lot of people who still probably think that about ME, because it's also known as chronic fatigue syndrome. Just for those people who don't know, what is living with ME like?
Living with ME is very restricting. I think you have to pace yourself and not do too much, because if you do too much, everybody has their own limits, and everybody's different. But you just have to pace yourself. So if you have something planned, for me personally, if something's planned, like a friend's birthday or something like that, or you're going out, I personally have to rest for the whole week and not do anything else, so that when I do go out, I feel okay. It's like, using up your energy. Everything uses up energy. A normal person would go to bed, have a good sleep, wake up and feel refreshed after having maybe a hard day. But someone with ME would feel unrefreshed after sleeping, and you just that ME, that feeling of no energy can go on for days, sometimes weeks, and it's like having the flu all over again. So it can put you in your bed for days or weeks. It's really it's not very great.
No, that's an understatement, I would imagine. Let me bring in Karina Raman from ME Action Scotland. Karina, we're hearing that Keith Anderson was based in Fife. He was the only specialised nurse. Why are these specialised nurses so important?
Morning, Laura. Well, ME, as we've just heard there from Paula, is a devastating, debilitating condition. And the idea that we are now left with no specialist clinicians at all in Scotland, and by that I mean nurses, doctors or consultants who are medically trained, it's just, as we've said, it's absolute rock bottom and it's not acceptable. What patients with ME, if they're able to be offered any support at all, and that's very rare, tends to be physiotherapy or psychology, which may offer some benefit to a small amount of patients who are well enough to access it. But it doesn't come close to the care and treatment options that are needed, especially if we consider that 25% of people with ME are severely affected by this condition, and that means they're housebound. So a physio appointment is never going to be appropriate in that scenario.
Why do you think there is, there are no specialist practitioners now? Why do you think the number has reduced? Is it because the profession doesn't take it seriously, or health boards don't take it seriously?
There is a huge issue, unfortunately, with negative attitudes towards the condition among healthcare professionals. This is a condition that's been historically stigmatised and misunderstood, so I don't think it's seen as an attractive area to work in. But the key here is that we need funding from the Scottish Government to support the boards to create services and attractive job opportunities to encourage people to specialise this and move into it, because we know the NHS is extremely stretched. That support isn't going to spring up from nowhere without considerable support and funding. And the Fife service itself actually only came about after a long campaign from the Fife ME support group. And Keith then himself spearheaded it and led it for almost two decades. And it was really his movement, and it can't be dependent on just one person. Keith was a brilliant man, and we're so grateful for everything he did, but we can't be left with this void after he's gone.
I wonder, is there more understanding of the illness now that people are coming forward? So many people are living with long COVID. They understand that viruses can cause longer, much more debilitating illness.
Yes, I think to some extent there is more of an awareness of post-viral illness and the huge effect it can have on people in the wake of the COVID-19 pandemic, sadly. But I think we all wish that if campaigners like the groups that I'm in and many others who came before me had been listened to 20 years ago when they were asking the Scottish Government for these services, we could be in a very different situation now. And we still see those negative attitudes perpetuating within healthcare, even though there might be more of us out in communities who have heard more about what these conditions look like.
And Paula, where do you get your support now? Or is it was it with other people who have ME, or are you just have you learned just to get on with it yourself?
I think over the years you just learn to get on with it yourself, support from friends and family. But, I think a lot of people with ME, they end up doing so much research, they probably know more about the disease and how to manage it, rather than they become experts. So you just learn to manage it yourself, really. Yeah.
And is there light at the end of the tunnel? Do you feel a time when you ever might get your energy back?
Yes, definitely. I would say, people who are severe don't give up hope, and I think the most important thing is to rest and pace as much as possible. So don't do too much and try not to sort of get in a dark place. Always try and think positive, because I think, I think positive thinking is always makes you feel better, doesn't it? No matter how bad it is.
Indeed. Well, on that positive note, let's leave it there. Thank you very much indeed, Paula Notman there from Dunfermline. And before that, we heard from Karina Raman, who volunteers at ME Action Scotland. A spokesperson for the Scottish Government said that it is up to individual NHS boards to decide on local services, but that it had carried out a recent analysis on ME provisions around the country and is identifying areas to support further.
Now, it is 8:24 and Phil is here with sport. Now, Phil, is Italian
UN resolution that calls for a temporary, and campaigners are warning that ceasefire in Gaza as soon as practicable. Washington has, until now, avoided calling for any sort of ceasefire between Israel and Hamas. The draft also opposes any Israeli ground offensive in Rafah in southern Gaza, where more than 1 million Palestinian civilians have sought refuge.